What is pathology or pathogenesis of patellofemoral pain syndrome? As I have told you, it's usually there was initial theory was it was also called as chondromalacia patellae. That was the problem suspected to be related to the cartilage thinning, and usually as it presented in many adolescent age group. But now the new theory of overuse injury has also emerged. Mainly the causes of patellofemoral pain syndrome include, first and foremost, is overuse injury. This is that due to overuse, these usually individuals are very active and athletic, and their adolescent age group. This results in cartilage loss and cartilage thinning, which may eventually lead to the subchondral bone being exposed and leads to a pain which actually is a diffused pain over and around the joint as well. The other causes is actually the muscle imbalance or weakness. This is a term called as miserable malalignment syndrome. This is composed of three entities in which the patient who's having this problem has actually increased femoral anteversion. As you know, on average, we have about an adult is 10 to 15 degrees of femoral anteversion. But if it increases too much, that actually creates a lot of malalignment, especially puts a lot of strain over the lateral aspect of our hip joint. Therefore, these patients who are suffering from miserable malalignment syndrome usually have increased femoral anteversion. They have a genovalgum, that is, then they have actually the knock knee, in which the distal part of the tibia is going outwards, and actually associated with external tibial torsion as well. So there's actually multiple problems. The whole malalignment of the lower limb is actually disturbed. Femur is increased anteverted, which means there would be increased rotation. There would be genovalgum at the knee joint, which means the knee joint is not normal but going outward, with external tibial rotation of the or external tibial torsion of the leg as well. So this puts a lot of strain actually on the patellofemoral joint, because then this leads to, even during normal walking mechanism, there's increased pressure and increased mechanical load on the patellofemoral joint, which leads to wearing of the or overuse injury of the cartilage, eventually leading to patellofemoral pain syndrome. Other causes which usually presents late is actually the muscle weakness associated with, for example, quadricep muscle weakness, or specifically vastus medialis obliquus muscle weakness. This may be present, and this may eventually lead to sort of a patellar maltracking during the normal flexion extension, and eventually leading to this problem. There is post-surgery, for example, nowadays a lot of TKR and THRs are going on. So post-TKR, if there is improper patellar maltracking, this may be leading to the increased pressure in certain areas of the cartilage of the patella, and patella may be actually touching the medial femoral condyle as well. For example, in our case study, when we got the MRI, her MRI showed there was a bone bruise over the medial femoral condyle. What happens is, if the patella gets tilted and during every movement it's actually hitting on the medial femoral condyle, this will eventually lead to bone bruises and bone formation. Therefore, patellar maltracking, muscle imbalance, miserable malalignment, all these actually contribute to or results in a cause of a patellofemoral pain syndrome, which is actually a vague syndrome, because it's not an acute injury. It's kind of a subclinical level. It's going on for quite a prolonged time, but once it results over the period of time, it leads to wear and tear and damage, and eventually it presents with patellofemoral pain syndrome. Then it's called as actually the acute injury. For example, patient had a trauma in which there was patellar fracture or patellar dislocation, and during this injury there was actually loss of cartilage or injury to the patellofemoral cartilage, which may later on lead to chondromalacia, and patient eventually during the rehab phase, patient may present with patellofemoral pain syndrome. Actually, the inciting factor was that injury or trauma which occurred quite a way back, but actually it has damaged the patellofemoral joint to an extent that it eventually would lead to lot of cartilage loss, and eventually the subchondral bone may be exposed, and eventually the exposure of the subchondral bone will eventually present with patellofemoral arthritis and patellofemoral pain syndrome. Therefore, these all elements have to be taken out. Briefly, we can divide them into three causes, that is the overuse, muscle imbalance and weakness, and injury. But when whatever happens initially, it all actually eventually contributes to other things. For example, if the patient has a malalignment problem, this will result in some form of muscle imbalance as well, and this would result in patellar tilt and patellar backtracking, and this will kind of a vicious cycle starts, which eventually leads to patellofemoral pain syndrome and patellofemoral joint arthritis. Another cause is actually iatrogenic one, that is during the surgery. Nowadays arthroscopic surgeries are being going on, and usually knee arthroscopy is a very common procedure. During arthroscopy, if the surgeon somehow damages the patellofemoral cartilage, this can eventually later on present as a surgical complication of a arthroscopic procedure and may patient result in a patellofemoral pain syndrome. Therefore, whenever we are doing surgery, we take utmost care to protect the cartilage, because it's once it's get damaged, there's very little regeneration, and usually it has its consequences. Now, if you see this pathogenesis, as I told you, there's always some degree of malalignment, and pull and push factors are always there. If you see this diagram over here, this is patella, it's attached to the quadriceps, but there's a quadriceps tendon over it. Underlying, there is some degree of there's a superior fat pad which actually, and along with the bursa, protects the tendon which is gliding over the distal femoral condyle. And when this patella glides, there is a patellar tendon. If this cartilage which is present on the femoral condyles as well as on the undersurface of the patella, it gets eroded, or if it gets thinned out, or there is fissure formation as well, this will eventually lead to exposure of the subchondral bone. And whenever during the flexion and extension, this subchondral bone glides past each other, this will eventually lead to increased painful sensations. And this is actually the main mechanism or pathogenesis of the patellofemoral pain syndrome. Due to whatever the cause, once the patellar surface has thinned out or the cartilage has been lost, there's the exposure of the subchondral bone is there, and subchondral bone has nerve endings which actually starts transmitting pain signals. And this, during the normal movements, for example flexion and extension of the knee joint, the patient continues to have pain. That is why whenever the patient with overuse injury, they usually complain of pain during the sitting or squatting of the knee joint, or whenever they climb the stairs, because during climbing of the stairs is usually flexion and extension. During the every stage of the stair step, you have one knee is going in a flexion, other is going actually into an extension. Therefore, if the cartilage is damaged, there will be overuse pain due to subchondral bone is actually exposed, and this results in cracks or fissure formation in the subchondral bone, eventually leading to microfractures, and which can be very painful. This is the underlying pathogenesis of the patellofemoral pain syndrome.